Hello everyone, hope you're having a good day. So today's topic for discussion is the tooth numbering system. Tooth numbering system is the first step in understanding the dental anatomy. It's a basic topic wherein it helps the students to number each tooth in the oral cavity as it appears so that we can avoid confusion when we see them clinically. So, in this topic, we'll be dealing with two important things, that is the dental formula and the tooth numbering systems. So, what are the different tooth numbering systems? The most commonly used tooth numbering system is a universal notation system, the Zigmondi-Palmer notation system, and the Federation Dentaire International. Now, we begin with dental formula. So, what is a dental formula? Dental formula is a denomination and numbering of all the mammalian teeth. In dental formula, there are three factors that is concerned with the dental formula. They are the denomination, the horizontal line, and the number of each tooth. How does denomination plays an important role? Denomination of each tooth is a representation of the tooth by its initial letter. Like for example, if we take incisors, capital I is the denomination of that tooth. Canine C, premolar P, and molar will be M. So that is about the denomination. Now coming to the second factor, which is the horizontal line. So in horizontal line, what is a horizontal line? So first we'll consider an oral cavity. When we consider an oral cavity, a horizontal line is a line that is dividing the upper and the lower jaw. And so this is a horizontal line which divides the upper and the lower jaw. And the upper jaw, as we all know, it's a maxilla, and the lower jaw, as we all know, is the mandible. That is a horizontal line. Now coming to the third factor, which is the number of the teeth. So what is the number of the teeth? It's there in the name. That is, it is representing the teeth that is present on the upper and the teeth that is present on the lower jaw. So when this number is written above this horizontal line, it is representing those teeth that is present in the maxilla, and when it is written below the horizontal line, it is representing those teeth that is present in the mandible. And in the end, dental formula, it's a combination of these three factors, that is the denomination, the horizontal line, and the number of each teeth. So how we write a dental formula is that first there will be the letter, that is the denomination of that letter, the letter of the tooth that is representing, then followed by a horizontal line, and then above the horizontal line will be the number of that particular teeth, and below will be the number of that particular teeth in the lower jaw respectively. Okay, now we'll discuss the dental formula of each dentition. Before discussing the dental formula of each dentition, the another thing that is to be kept in mind is that the dental formula is always including only a one side. Okay, that is when we write dental formula of one dentition, it is representing one side of that arch, that is the right side or the left side of the oral cavity. Now we'll discuss the dental formula of the deciduous teeth. So in a deciduous teeth there are 10 teeth, okay, on one side, that is 5 in the upper and 5 in the lower. The dental formula is written in such a way that first there will be the denomination of that teeth, that is there are 2 incisors, right? So I will be there, which is representing the incisor, followed by a horizontal line, and the number of teeth that is present in the upper and the number of incisors present in the lower jaw. So upper there is 2 and lower there is 2. Then followed by canine. Canine C, where there is 1 in the upper and 1 in the lower. Molar, 2 in the upper and 2 in the lower. Totally there is 10 in number. This is one side, okay, that is to be remember, that is this is one side of the oral cavity. So inside, so it will be written in such a way that I 2 by 2, C 1 by 1, M 2 by 2 equals 10. So that is the general formula of the deciduous teeth. Now, coming to the dental formula of the permanent teeth. So, in one half of the oral cavity, there are 16 teeth. That is 8 in the upper arch and 8 in the lower arch. Now, how will we write the dental formula of this teeth? That is, how is it? That is, we have to remember another thing is that there is a premolar also included in this. That is different from the deciduous teeth. So, in a permanent teeth, the dental formula will be such a way that I 2 by 2, that is, there are 2 incisors in the upper arch, 2 incisors in the lower arch. Then there is C 1 by 1, that is, 1 canine in the upper arch, 1 canine in the lower arch. P 2 by 2, that is, there is a 2 premolars in the upper arch, 2 premolars in the lower arch. M 3 by 3, that is 3 molars in the upper arch, 3 molars in the lower arch, equal to 16. So it will be written like I 2 by 2, C 1 by 1, P 2 by 2 and M 3 by 3 is equal to 16. So that is about the dental formula of the permanent teeth. So when we write the dental formula of deciduous as well as the permanent teeth, it will be those teeth that is present on one side of the oral cavity. Now that was about the dental formula. Now we'll discuss about the tooth numbering system. So in clinical practice, some kind of a shorthand system is there for the tooth notation so that it is important for recording data. Systems that is used by dentists to associate information to a specific tooth. To do so efficiently, it is necessary to adopt a type of code or a numbering system of teeth. Now, before we consider the different tooth numbering systems, first we'll understand what the dental quadrant is. Understanding dental quadrant is important for understanding tooth numbering system. Now, when we consider an oral cavity, dentist has divided the oral cavity or the dentition into 4 quadrants. That is first, second, third and fourth quadrant. These quadrants are divided by 2 lines, that is a horizontal line and a vertical line. Horizontal line will be dividing it into 2 halves, 2 jaws, and the vertical line will be in the middle line of the oral cavity, dividing it into different sides. Now there are 4 quadrants. There is a first quadrant and a second quadrant which is there in the upper arch, where the first quadrant will be representing the upper right section and the second quadrant will be representing the upper left section. Now there are 2 other quadrants in the lower arch, that is the third quadrant and the fourth quadrant, where the third quadrant is representing the lower left section and the fourth quadrant will be representing the lower right section. Now when we prepare a dental charts, it's always from a dentist perspective, that is, wherein the right side of the patient is shown as a left side in the chart and vice versa. It is important to understand the quadrants so that when we use a tooth numbering system, we can give designated numbers to each teeth. So that is about the different quadrants. So the dental quadrants is important to understand the tooth numbering system so that we can divide there are 4 quadrants in the oral cavity. There is a first, second and third and fourth, where it will be easier for us to represent each individual teeth that is present in the different quadrants. Several tooth numbering systems are used around the world. Of them, there are 3 main systems that is accepted by all the dentists. They are the Universal Notation System, the Zygmundi and Palmer Notation System, and the FDI system. First, we'll deal with the Universal or the ADA system. This was first adopted by ADA or American Dental Association in 1968. It was commonly used by American dentists. The main advantage of this system is that it follows a sequential pattern of naming teeth and can be easily understood in locating a concerned tooth. Now we'll discuss the tooth numbering systems of each dentition. First, the primary dentition. In the primary dentition, when we are numbering the primary dentition, we'll be using alphabetical order in an uppercase, wherein the maxillary teeth will be beginning from the A to J and the mandibular teeth will be from K to T. So, When we are numbering a dentition, a primary dentition, it will be beginning from the posterior part of the posterior part of the upper right quadrant, that is the right second molar, will be assigned the capital letter A, and it will be following around until letter J, where it will be representing the left second molar on the left posterior side. And this system will be following the same pattern in the lower arch also. That is, this system follows the same pattern in the lower arch, where it will be numbered, or it will be alphabetically represented from K to T, where K will be designated the lower left second molar and T will be on the lower right second molar. So another thing that is to be kept in mind is that they will be represented by capital alphabetical letters. So it is in the primary dentition, it will be um, numbered from A to J in the maxillary teeth and K to T in the mandibular. So now this is a diagrammatic representation of a primary dentition, wherein when we are actually giving the universal notation system, it will be following a sequential pattern from A to J from the upper right second molar, which will be represented by the capital letter A, which will be followed till the upper left second molar, which will be represented by the capital J. And in the lower arch, it will be following the same pattern, that is from K to T, where K will be representing the lower left second molar and T will be represented by the lower right second molar. So this is the universal notation system when it is used in the primary dentition. Now coming to the permanent dentition, in permanent dentition they also assigned a number of sequence. Okay, but here they are not using the alphabets, but they are using the numbers. Like from 1 to 16 will be representing the maxillary teeth, and from 17 to 32 will be representing the mandibular teeth. So the numbering starts from 1, where it will be representing the upper right third molar, which will be followed till 16, which is on the left side, which will be representing the upper left third molar. Now coming to the lower arch, it will be numbered from 17 to 32, which will be from the left to right, where 17 will be representing the lower left third molar and 32 will be representing the lower right third molar. So this is a sequential arrangement of number in the universal notation system when it is used in the permanent dentition. So it is numbered from 1 to 16 in the upper arch and 17 to 32 in the lower arch. This is a diagrammatic representation wherein it is explaining the same sequential pattern of numbering a permanent dentition, where it will be followed from, it will be written from 1 to 16 in the upper arch, where 1 is the upper right third molar and 16 is the upper left third molar. And when coming to the lower arch, it will be going from 17 to 32, where 17 is representing the lower left third molar and 32 will be representing the lower right third molar. So that is the about the universal notation system of the permanent dentition. So we had explained the permanent universal notation system of the primary dentition as well as the permanent dentition, and also it is one of the accepted notation system by the ADA. So that is about the universal notation system. Now we'll discuss the second notation system, that is a Zsigmondy or Palmer notation system. It is a symbolic system which was introduced by Adolphe Zsigmondy in 1861 and then it was modified in 1874. This system divides the arches into different quadrants, and also a unique symbol is also present to identify the teeth in the different quadrants. The numbering runs from the center of the mouth to the posterior part of the teeth. So if we take the deciduous dentition, it will be from A to B, from the midline to the posterior most teeth, and it will be following this sequence in each quadrant. So now when the Zsigmondy Palmer notation system is used in a primary or a deciduous dentition, it will be using an alphabetical order from A to E, where A will be written in the midline and E will be representing the tooth in the posteriormost teeth. This will be following the same sequence in all the quadrant, which will be A will be in the midline and E will be the posteriormost teeth. Now, this is a diagrammatic representation wherein we can see that there is a symbol present before the letter. That is a symbolic representation of the quadrant. So, when we write E, that is when we are representing an upper right second molar, this symbol will be written in front of E representing that quadrant. And when we are writing a lower left second molar, E will be present, and before that and the corresponding symbol will also be present. This is how a Zygmundi-Palmer notation system is used in a primary dentition. Now, when the Zygmundi-Palmer notation system is used in a permanent dentition, here a numerical system is used, wherein it will be written from 1 to 8 in all the quadrant, where 1 will be representing the tooth in the midline and 8 will be representing the tooth in the posteriormost teeth. Now, this is a diagrammatic representation wherein the symbol is present before the number, where it will be representing that quadrant. So, when we are saying an upper left third molar, it will be written as 8 and before that there will be a symbol. Okay, so just like that, a symbol will also be present before the number, and it will be written from 1 to 8, where 1 will be representing the central incisors and 8 will be representing the posteriormost teeth, be the third molar. So that is how a Zygmundi-Palmer notation system is used in a permanent dentition, and we had discussed how it is used in a primary dentition. And in this, a symbolic representation is used to represent the quadrants that is used. Now, coming to the third notation system, which is known as the Federation Dentaire International or the FDI system. This is a two-digit system which is adopted by the WHO and by other organizations such as the International Association for Dental Research. Here, there are two digits. That is, the first digit will be indicating the quadrant and the second digit will be indicating the tooth within the quadrant. Now, when we use this Federation Dentaire International system in a permanent dentition, each tooth will be numbered first by the quadrant and followed by the tooth that is present in the quadrant. The quadrant will be numbered from 1 to 4, wherein 1 will be representing the maxillary right, 2 the maxillary left, 3 the mandibular left, and 4 the mandibular right. And the tooth will be numbered from 1, which is representing the midline tooth, that is the central incisors, to 8, which is the posteriormost teeth, that is the third molars. So when it is representing the upper right quadrant, it will be given the numbering from 1 to 1 and when it is representing the upper left quadrant, it will be numbered from 2 to 2 and when it is representing the lower left quadrant, it will be numbered from 3 to 3 and when it is representing the lower right quadrant, it will be represented from 4 to 4 Now, when we see the diagrammatic representation also, we can see that it is numbered from 1 to 1 wherein each teeth will be given an individual number. And now, for example, if we say 6, which will be the tooth that is representing, it will be the first molar of the right teeth. So, right permanent first molar. And when we say 5, it will be the lower left second premolar. So that is how the numbering is done. That is, when we say 8, which is the tooth, 8 will be the low upper right third molar, and when we say 3, which will be the lower left canine. Okay, so that's how the numbering of the FDI system is done in a permanent dentition. And when the FDI system is used in a primary dentition, the first digit will be indicating the quadrant, where the numbering is given from 5 to 8, where 5 is the upper right quadrant, 6 the upper left quadrant, 7 the lower left quadrant, and 8 is the lower right quadrant. And the second digit will be indicating the 2 that is within the quadrant, which will be given from 1 to 5, where the 1 is the middle tooth and 5 is the posterior most teeth. When we give the numbering for a deciduous dentition, the upper right quadrant will be represented from 5-1 to 5-5, upper left quadrant will be represented from 6-1 to 6-5, lower left quadrant will be represented from 7-1 to 7-5, lower right quadrant will be given from 8-1 to 8-5. And when in the diagrammatic representation also, we can see that it is numbered from 5-1 to 5-5, 6-1 to 6-5, 7-1 to 7-5, and 8-1 to 8-5. So for example, if we say 6-3, it will be the tooth that is the upper left canine will be represented. And if we say 7-5, it is representing the lower left second molar. That is how a primary dentition is written by using a FDI system. So we had discussed about the FDI system when it is given for the permanent dentition as well as a primary dentition. We had said that the FDI system uses two-digit system, wherein the first digit is representing the quadrant and the second digit represents the tooth that is present in the quadrant. In permanent dentition, it is numbered from 1 to 8. 1 to 4 is the quadrant that is represented and 1 to 8 is the tooth that is present. In the primary dentition, the quadrants will be given numbered from 5 to 8 and the tooth numbers will be given from 1 to 5. So this is about the FDI system. Now, those were the main important tooth numbering systems that is present. These are not the only one, there is others also. One of them is the Haderep system, which was introduced by Victor Haderep in 1891. This is a variant of the 8-tooth quadrant system, that is the Zsigmondy-Palmer notation system, wherein in this system they use plus and minus signs so that we can differentiate between the upper and the lower quadrant. So with this, we come to the end of today's discussion, where we had dealt about the dental formula and the different tooth numbering systems, and we had seen which are the main important tooth numbering systems that is used in dentistry. If you have any doubts regarding this topic, do comment down below, and more videos will be coming soon. Thank you.